The Worker Role Interview, or the WRI, is a semi-structured interview designed to be used as a psychosocial environmental component of the initial rehabilitation assessment process for the injured worker. The interview is designed to have the client discuss various aspects of his or her life and job setting that have been associated with past work experience. The WRI combines information from an interview with observations made during the physical and behavioral assessment procedures of a physical and/or work capacity assessment. The intent is to identify the psychosocial and environmental variables that may influence the ability of the injured worker to return to work. Before starting the interview, you must initially gather preliminary data from client records. Client records, if available, should provide you with information which will suggest if this client is appropriate for the interview, and should provide the information that will assist you in tailoring the interview to the particular client. It should be noted that not all clients are good candidates for an interview for a variety of reasons. Examples of clients who cannot give reliable reports are persons with acute emotional distress or significant cognitive deficits. Therefore, you must determine if the client is capable of giving a reliable report. Once you have decided that the client would be a good candidate for this interview, the therapist can begin to prepare for the interview process. You will need to copy the pages in the manual, which include the questions for the interview, which can be found on pages 9 through 15, and the pages of the rating scale, which are on pages 19 to 31. The interview can take place in any environment which is suitable for the therapist and the client. The therapist will go through and ask the client all the questions in the interview. The therapist is free to add questions where appropriate and skip questions which have already been answered or do not apply to the client. The interview consists of 7 content areas, which include personal causation, values, interests, roles, habits, and environment. The following are some examples of questions you will see in the WRI. What parts of your job do you feel you are unable to do because of your injury? Is an example of a personal causation question. Do you have high standards for your work? Is an example of a values question. And tell me about your typical day outside of work is an example of an interest question. What were your duties on your previous job is an example of a role question. How has your injury affected you outside of work is an example of a habit question. Tell me about your boss. Do you think he or she will be supportive in your returning back to work is an example of an environment question. Once the interview has been completed, the therapist will use the rating scale to determine if the answers given support the client returning to work or not. The rating scale is a 1 to 4 scale, with 1 meaning that the item strongly interferes with the client returning to previous employment, and 4 meaning that the item strongly supports the client returning to previous employment. You may also use NA to express that there is not enough information to rate the item, or the item does not apply to the client's particular employment situation. You may also include comments along with your scores. The WRI can be used during the evaluation process, and in addition to the interview, other items such as strength, lifting, range of motion, pain, and work simulation may be assessed depending on the facility. A discharge rating of the WRI rating form is recommended prior to discharge, following the completion of the entire rehabilitation program. There is no need to complete a second interview with the client at discharge. The procedure to be followed is the same as when completing the initial rating of the WRI. The discharge rating will encompass impressions from the complete rehabilitation program. By rescoring the WRI following the entire rehabilitation program, you will be able to assess which areas the client improved, worsened, or stayed the same.